Hello, my name is Patricia Norvell, and I am doing a speech called Let Me Convince You. This speech is about MS, which is multiple sclerosis, and I'm hoping at the conclusion of this speech that you will try to help people with disabilities and it will bring you to a better understanding of people that suffer with MS. I, for one, have MS, and that's one of the main reasons that I wanted to do this. Multiple sclerosis is a chronic disease. There is no cure for it. However, there are treatments. The treatments come in the form of shots, and are one that is in a pill form to the best of my knowledge. I myself get weekly injections of a medication that is called Avonex. The medication, basically, it helps prevent your MS from spreading further, from doing more damage than what it's already done to your body. And a lot of it, of course, is dependent upon how far into the disease your body has been subjected before you are diagnosed with MS. The disease, excuse me, is a disease of the central nervous system, or an autoimmune disease. The central nervous system is comprised of your brain and your spinal cord. The autoimmune disease means that your body's own immune system is attacking you. In this case, it's targeting the cells in your brain and your spinal cord. There are over 50 symptoms that are linked with MS, which is why it is so hard to determine if a person truly has MS or not. And these symptoms, and these are just a few, mind you, are fatigue, depression, bladder dysfunction, numbness and or tingling, bowel dysfunction, dizziness, and vertigo. And vertigo it's like, let's say you're walking and then all of a sudden you get the feeling that the room is spinning around and you feel like you're going to pass out. Well, vertigo is similar. The only difference is you experience these same symptoms when your eyes are closed, like when you're laying down getting ready to take a nap. You also experience tremors, vision problems, cognitive impairment, which is one of the key factors that I have, and so it makes it really hard for me to get my homework assignments turned in a timely fashion sometimes. And you also experience sexual dysfunction and pain. And the pain is really, really sharp and intense. And of course, a lot of these symptoms are common and a lot of other diseases and disorders, which, like I stated before, is one of the reasons it is so hard to determine if a person has it or not. Now, here are the following tests that can be done to help aid them in discovering if you have MS. One of them is checking your medical background, doing a neurological exam, which consists of watching how you walk, listening to how you talk, checking your eyes, doing a psychological evaluation, checking your nerve endings by attaching these electrodes to your skin. They start with your fingers and work their way up your arm where the vital nerve points are, and they give you little bolts of electricity. So you have these shock sensations that you feel. They do blood tests, but the blood test is just to rule out other factors. It's not used to determine if you have MS or not. Oh, and two other key areas of finding out if you have MS is one is a lumbar puncture, which is a spinal tap. It's where they put a needle in your back to lower part of your back to withdraw fluid out of the base of your spine, and then they test it almost immediately after obtaining the fluid, and then they recheck it again at the end of 3 days, 72 hours, to see if there's any changes in the culture. And the other big one is an MRI scan. And the reason they do an MRI versus a regular X-ray is because an X-ray only shows the outside of a bone. It doesn't show the insides of the bone or fluid, stuff like that. Whereas an MRI can take layers, go through different sections until it finds what the problem is, if there is one. People with MS often suffer infections. The infections can cause a relapse, which means your medication will stop working for you. Excuse me. Now, overheating is a big problem that I have, and the heat causes symptoms to get worse temporarily. So you have to try to do your best to stay cool, to stay as cool as possible. With the stress and fatigue, this can be an increase and relapse during or right after periods of extreme stress. Fatigue makes all of the symptoms of MS more difficult to deal with. Now, there are ways you can stimulate your nervous system, preferably by using homeopathic remedies such as euthanasia, Asian ginseng, and licorice. And you can get a lot of these in different herbal teas and like teas that they recommend if you have a cold. Well, now that I see the my time frame here is coming to an end, and I don't want to go over my allotted time. So what I will do now is I'll show you the two images that I copied. One of them, this is what a nerve looks like. See that? Sorry about that. This right here is supposed to be your brain. It sits above the top of the nerve. This is the nucleus right here. And then this part right here, where it's a spinal cord, that's the myelin sheath, which covers your nerve. That is the part that the MS attacks the most. And then you have your nerve endings down here. And I got this image here from wikipedia.com. Now, the other one and final one is an MRI of the brain. My son was nice enough to highlight that with a marker for you so you can see the lesions. That's what all those white areas are. Those are MS lesions on the brain caused by the multiple sclerosis. And I obtained this from the Multiple Sclerosis International Federation. If you choose to go there to learn more about MS, the link or URL site is msif.org / the /en / about _ms / diagnosing _ms.html, and I'll show it to you here. Hopefully you'll be able to see that. There we go. Would you look at that for a couple seconds? Sorry. Okay. Well, thank you for taking the time out to view this, and I hope it gives you a better understanding about MS. And praise God, one day a cure will be available for us. Thank you for your time.